Hi, can I tell you, relapsed. Long story if you go back from my YouTube channel. I've just come out of 21 days of recovery at the RPA in Sydney, and recovery is for cancer that is being described as lymphocyte-rich T-cell, or T-cell lymphocyte-rich large B-cell diffuse Hodgkin lymphoma. Yeah, I'm told it's a very aggressive one. So we did our 3 months of chemotherapy, which you do at home, and yeah, there was dramas on that. This is what I've just done now was the autologous, whatever they call it, the stem cell transplants from your own body. And I've been in hospital for 21 days now. And this is one of the today I can stand up and walk around a bit and not feel that I have to depend on heavy drugs to remove pain. But the mouth goes and the stomach goes. That's the hints. I won't spoil surprises, but this is me feeling better. But I charted the last 21 days my white cell counts, just to illustrate the decline. The treatment's called BEAM, and you take BEAM over 7 days. So up to this point, 0. It's been 7 days at hospital taking the chemotherapy. So every day you're taking chemotherapy. The drop of your white blood cells, which is important to your existence, occurs very rapidly. And they call it day 0 because day 0 is when I reintroduced my stem cells that I had pulled out from a previous appointment here at RPA. And yes, I've been for a number of days without white cells in my system to protect me from anything, including coronavirus. But let's say what's been attacking me is my internal gut bacteria, and that's what's making me pretty sick. So I've ended up on food that comes out of a bag that's fed through me intravenously 24/7 to keep me alive. You need this stuff to stay alive. You need this stuff to get you to the next stage. I think I've handled it well. I don't look like a squash cockroach at the moment, but probably some people would say I look good. But yeah, I've got a lot of things intact, but it is a long road with this treatment. I've got a pick. I've got a line in my arm, and I've got Hickman's pick, which is a line in my above my elbow to make it easier. What else? I mean, there's a lot of lethargy, lethargic. I haven't eaten food. Don't have a desire for food. I'm stuffing myself with some food, and I just get the diarrhea hits. So yeah, if you're not into diarrhea, it's not one that I recommend it or visit for. But yeah, it's the gut pain. A lot of gut pain from your internal guts, trying to go through your cell walls and infiltrate all parts of your body. And if you don't have any underlying issues like I'm pretty good at the moment. You'll just have to put up the pain and go through it. The mouth was another one. Hold from the top all the way down. It's just like a mushy goo in there. It's like thrush and candida, and it's not even, I couldn't even say it's custard, but it grows on your tongue. And so just trying to give you a vivid descriptions to say this is real. But in fact, it's not that you cruise through it, but it's just you just got to let the whole process go through. In 21 weeks, I'm stunned that I slept in a bed for 21 weeks. Sorry, 21 days. Keep my brain. 21 days. Yeah, the mind starts to want to do things. The mind wants to gather things, and suddenly you think you're a supercomputer and lying on a hospital bed. That could be the opioids, I don't know what it is, but yeah, so that's my journey so far. I just do checkups from now on. So the good thing is I'm quite happy to be at this point looking out and saying, yeah, that was crap, but looks like some smooth sailing ahead. Let's hope that this catches on, that the nasty stuff doesn't come back in. I've seen other patients walking around the wards. I've spoken to a few other people. Yeah, this is something that they do, well, we all do in the cancer treatment of patients, to get ourselves to the next stage. And if you say no to it, then you're really just, you're not climbing a mountain, you're just trying to jump over a little tiny hill. So make an effort to climb the mountain, because it's actually a beautiful view from the top. That's all I've got to say. But hopefully I'll get some time. I'm looking better, feeling better, to update this. But I'm still here, I'm still alive after all this trauma I've been going through for the last how many years, dealing with Hodgkin's lymphoma and all that sort of stuff. All the best, and looking forward to better days, which is like I'm enthusiastic for. Cheers.